Hey Sleep Warrior, I'm Dr. Kimberly and welcome to a special edition of our Sleep Byte series. Catherine asks, I took the home test. It came back as mild. Now what should I do? Well, Catherine, mild sleep apnea is a little bit tricky. The bottom line is that for mild sleep apnea, we don't have great data showing that over time it decreases a lot of your cardiovascular risk factors. Now, that being said, severe sleep apnea causes more problems than moderate sleep apnea, which causes more problems than mild sleep apnea. So it may be that we just haven't looked long enough to make this correlation with mild sleep apnea. But because we don't have the data, for now, what we recommend with mild sleep apnea is to treat based on your symptoms or your comorbidities. So if you're having a lot of daytime sleepiness, or you're waking up not feeling refreshed, problems with concentration, memory, irritability during the day, then I would try treating it because it may improve these symptoms that you're experiencing. Likewise, if you have other medical comorbidities, specifically high blood pressure, heart disease, history of stroke, even diabetes, all of these things can be made worse by untreated sleep apnea, and it may benefit you to go ahead and treat it. So it really depends, but when in doubt, I would consider treating, and if it doesn't work for you or you can't tolerate the treatment and you only have mild sleep apnea, then you may choose an alternative therapy or to not treat at all. So that being said, there is one caveat, which is that home apnea tests do tend to underestimate most obstructive sleep apnea. So if this mild sleep apnea was diagnosed based on a home apnea test, well, it may actually be worse, indicating that there would be even more reason to go ahead and try to treat. So thanks so much. Thanks for your question. Dmitri asks, hi, I use nose pillows. When I lay on the bed pillow, do nose pillows tend to leak? Well, that depends, and I would ask you the question, are you noticing leak when you're laying on your side? So your machine can give you a leak number, or you may wake up with some annoying sounds in your ear because the mask is leaking. So if that's happening, then you may try repositioning your pillows or trying a CPAP specific pillow. So they do have some rather expensive, I will say, pillows out there that have a little divot in the side that allow you to have less pressure on your mask when you're sleeping on your side. I will say that some of the newer masks, for example, the Dreamwear mask where the air is coming down both sides, when you are pushing on one side and it's collapsing that part of the nasal pillow, the air still continues to go through the other side, so you're not losing any pressure. Don't worry. Thanks for your question. Carol asks, how often should I wash my CPAP supplies and water chamber? So this is a very common question. Ideally, you would at least rinse these components out every day, especially your mask. But I would say for your water chamber, wash it with some mild soap and water and let it air dry at least once a week. Your mask, I recommend rinsing it out and letting it air dry every day, and at least once a week use some mild soap and water, including washing out the tube, hang it over the shower stall, let it dry completely, and put it back on and get started the next day. So thanks for your question, Carol. Whitney asks, if I need a BIPAP, can I use a CPAP instead? Well, there's no easy answer for this because it really depends. A CPAP has one continuous pressure that is going in, and it's usually indicated for most obstructive sleep apnea. Now, bi-level goes in at one pressure and then drops down and comes out at a different pressure. So there are a number of reasons why somebody might use a BiPAP machine instead of a CPAP machine. One of these would be if you don't tolerate that pressure of a CPAP machine, or you find it really difficult to exhale against the constant inflow of pressure from a CPAP machine. A BiPAP may be easier for you. There are a few medical reasons as well when a BiPAP is used, and this can be if you are significantly overweight. Sometimes bi-level can help to keep your lungs inflated better, and that can work better than a straight up CPAP machine. Or there are other neuromuscular conditions that sometimes benefit from a bi-level over a CPAP machine. So for most people, you can use a CPAP, but if you're recommended a BiPAP, I would talk to your provider about why that is and if it might be worth trying a CPAP instead. Thanks for your question, Whitney. KJ asks, I have been on CPAP therapy for a couple of months now. I was hoping my blood pressure would have come down by now. Does that mean the root cause of my elevated blood pressure is not from sleep apnea? Well, blood pressure elevations can be from many different reasons, but we do know that untreated sleep apnea does lead to increases in blood pressure, and this is because when you stop breathing at night, your body goes through a bit of a fight or flight, and your blood pressure goes up every time in order for you to breathe, and after the apnea is over. So once you get on CPAP therapy, it's very common for blood pressure to stabilize or even come down in some circumstances. Years of untreated obstructive sleep apnea can lead to significant high blood pressure. And once you get it treated, that doesn't always mean that the blood pressure is going to reverse and go back down, because a lot of damage has already been done over time. And so it doesn't necessarily mean that the sleep apnea was not the root cause of your elevated blood pressure. It's just that at this point in time, treating the sleep apnea is not going to reverse the damage that was done in the past from the untreated sleep apnea. Now, that being said, all is not lost. By treating your sleep apnea now, you will prevent further problems with blood pressure in the future. For example, if you weren't treating your sleep apnea, then your blood pressure would be expected to continue to get worse over time. But now that you've got it treated, you should be in much better shape. So good question. Thank you, KJ. Thanks for being here. I will see you next time.